And joining us today in our book talk segment, great to welcome one of the co-authors of a very interesting and helpful book. It's called Beyond Addiction, How Science and Kindness Help People Change. We're joined today by Dr. Nicole Kosanke from up in New York for the Center for Motivation and Change, and she joined us by telephone. And Doctor, good to chat with you today. How are you?
Thanks so much for having me.
Good to have a chance to talk with you. I read through the book and always kind of been fascinated by this kind of a topic. Obviously, so many people, unfortunately, go through addiction problems, and I guess there's always been kind of debates on the best way to treat it, right? So your book kind of goes into, is it new or just a different way of treating addiction, or how people around those most addicted can help out better? Is that right?
Yeah, there have been debates, and really over the last couple of decades, a lot of research has been done about how people change and how motivation works and how we can influence changes on the behalf of somebody that we love. So, I think our field has done a pretty poor job of actually disseminating that information into the public and into the treatment sphere. So we really wanted to write a book that was for families to help them from sort of start to finish understand motivation and substance abuse and how to influence people and understand what the treatment options are from an evidence-based perspective, what the science tells us about all this.
And you hear so many times, particularly with celebrities, but obviously to anybody who has an addiction problem, go to rehab, and then that's all you hear about it. You don't really hear what goes on in rehab to hopefully help them get better. So I guess there's even different kinds of rehab centers or what they do, right?
Right. I think that's one of the myths is that, the only way to really get better is to go to a 28-day rehab, let's say. and I think that actually, there is a wide range of options, from just having a meeting with your general practitioner to meeting once a week on an outpatient basis with a therapist, doing groups, doing a day program. There's such a wide range of options, and actually rehab is often not the best choice because it's a pretty big gun to use first thing out, and it is eventually necessary in certain cases that become more extreme, but there are a lot of things people can do before kind of pulling that trigger, and I think that by continuing to think that rehab is the only or best way to start off in addressing this problem, what we have is a lot of people who are pretty reluctant to pull that trigger for themselves and for their loved ones.
It seems that is almost the last resort, whereas maybe some other treatment options might be better at the beginning.
Exactly.
That's my impression anyway. I don't know firsthand, but is that right?
Absolutely. I think we think about all other medical issues in that way, just like you described, that we would start with the sort of least intrusive option and go up from there depending on the level of severity and whether or not that lower intensity treatment option had been effective, and not start with sort of in the most invasive surgery, but in fact start sort of on a lower level.
I guess the analogy would be a diet change as opposed to having major surgery.
Exactly. You make those big choices when you absolutely have to. Somebody who's worried about their drinking or worried about their husband's drinking, it may be a really big hardship for that person to leave work for a month, and actually they could potentially make changes well before then.
Do we know why, Doctor? Some people become addicted maybe faster or more severely than others. You hear different variations. People can, have a few drinks and they're fine, and other people have one or two and they're in terrible shape. Or same with drugs too, I guess. Do we know why?
Yeah. Well, we know a lot of more information than we used to, and I think actually probably in about 10 years we're going to have even more information. The knowledge base around this is really rapidly increasing. So there are environmental pressures. So, a lot of people will say now, if I were a kid these days and had access to all this stuff, I don't know what would have happened to me. So that's really an environmental situation, right, where we have access to something that maybe we would try if it were around us all the time, whereas if you just don't have access to that, that's less of a possibility. And then some people are really genetically predispositioned to have these kinds of problems because they have a big family tree filled with these kinds of problems. And I think there's a lot of different pieces to it. There's also a lot of research that tells us that psychiatric problems really come together oftentimes with substance abuse problems. So if you have depression, for instance, you have a higher likelihood of developing an alcohol problem. If you have mood disorder problems, you have a higher likelihood, ADHD, etc. So there are certain things that put you into a higher risk category.
Yeah, it also seems like people, maybe the last 10 and 15, 20 years, when something's not going right, the first thing is to get prescribed something to help them, whereas in the old days, you didn't have that option or you just didn't do it. You just toughed it out. So I guess that's a different attitude today, isn't it?
That's true, and I think that there's the good news and the bad news about that, right? So, the good news is that a lot of conditions are identified and treated earlier in a positive way than they used to be. Mm-hmm. So people have more access to mood disorder treatments. They have more access to pain medications. And these are important developments that have happened in terms of progress with medicine. But the downside is that, kids, especially teenagers, have access to medicine cabinets that have, a lot more things in them to try out when they're in that exploratory, adventurous period. And right. I think families really need to know that that's a real risk.
Well, part of the title of the book, we said, is How Science and Kindness Help People Change. We talk a little about the science part of it. Talk a little about the kindness part. You had a lot in the book about that.
Yeah, I think that people don't usually put those two things together, thinking about science and kindness. And that's exactly why we put those words in the title, because I think people usually think about being confrontational, being, adversarial, really, with somebody who has these kinds of problems. And actually, we have a lot of research that tells us that those kinds of approaches tend to push people underground. They make people defensive. They make people feel cornered. And there's a lot of evidence that tells us that really kindness and being supportive of positive behaviors is a much better strategy overall to influence someone's motivation.
And as frustrating as it can be for a family or a friend of somebody going through this, yelling at them isn't going to help.
It really isn't. I mean, in the moment, it can feel, gratifying or feel like it's really the only thing that you have left to influence someone is to scream a little louder. But, you just think about how it feels to be yelled at yourself. You know that that's not likely to increase your chances of wanting to make changes or to please someone. So, the evidence really shows us that more confrontational strategies, yelling, screaming, name-calling, all that stuff really does not help someone make changes.
Well, it's a fascinating book and provides a lot of great information. I think people will get some help from it. It's called Beyond Addiction. We've been talking with Dr. Nicole Kosanke today from the Center for Motivation and Change up in New York. And, Doctor, give out a website. People can get a hold of you or the book.
Sure. So our website here at the Motivation and Change is motivationandchange.com, and there's a ton of information and articles there to help families. Also, BeyondAddictionBook.com is the book's website, and you can kind of look at different chapters for free looking at that site.
Great. Doctor, appreciate you taking a few minutes, doing good work up there, and come down to Florida and visit us sometime.
Okay.
Get out of New York.
Thanks so much. Appreciate